Okay, thank you very much. So this is very much a joint presentation today, and Dr. David McVea will be speaking after me, and we will also be joined by Jeffrey Truve, the BC CDC, as he's our resident expert on our data repository and the BC CDC map. So I'd like to begin the presentation with a disclosure that our funding for our work comes from the provincial and federal government. We declare no commercial interest in the radon industry. And in particular, we don't sell radon test kits or provide mitigation services, and that I am personally part of the Take Action on Radon program, which I'll be talking a bit about today, that is funded by Health Canada. And echoing Tina's land acknowledgement, I think working in radon, I have a particular acknowledgement that I would like to make. This is a painting that was done by one of the group of seven in 1938 called Uranium Mine, Northwest Territories, Canada. And it speaks in part to the history of this nation as a uranium-rich country, and also the contribution that Indigenous peoples have provided in terms of their health. So people who worked in uranium mines, which included many Indigenous peoples, helped us better understand the relationship between radon exposure and uranium radon exposure and lung cancer. So I am deeply grateful for the contribution to science that is often not discussed from Indigenous peoples. Today, I'm going to give a very brief history of radon. I'm going to assume that most of you that are on this call are here because you know what it is. I am also going to talk about some updated estimates. We have had some new research in Canada looking at exposure and how many people are exposed. I'm mainly going to focus on how public health can engage with radon, some practical examples, and then David's going to give an example here in British Columbia, what we're doing with the data that's been collected. And in the picture on the left, one of the things we struggle with, both in the media and in public health, is how to convey images of radon because it is a tasteless, colorless, odorless gas. So how do you do that? And I would just like to thank the people that Take Action on Radon because they have taken pictures of radon testing and made them freely accessible to people. So in this picture on the left, you'll see there's a little alpha track passive detector sitting next to the very nice pictures of the cactus. So if you would like to help put something else on your slides other than just like the radon symbol or the atomic number, there are a number of pictures and they are freely available. They don't necessarily show which brand of detector it is, so you don't have to worry about advertising. But I just think it was an excellent piece of effort that can really help people when we're trying to convey to people what we want them to do and we want them to get testing. So as I'd mentioned, radon is an invisible, odorless, colorless, tasteless, and radioactive gas. It is listed within the periodic table and flagged for its radioactivity, and that is because it is part of the decay chain of uranium. And as I mentioned, uranium is ubiquitous in Canada. We've been long known as a uranium-rich country, and the uranium is distributed across the crust of the Earth. And in some parts of Canada, we naturally have more levels of uranium. That includes places like northern Saskatchewan, parts of Ontario, the Maritime provinces, and here in the interior of British Columbia. Radon is generated from the breakdown specifically of radium, and you can see there it's present for almost 1,600 years in the soils. And then over time, it kicks off radon gas. And this is why radon is so interesting because the metals themselves remain in the soil, but the gas can move. And it moves from cold, dark spaces into open, warmer spaces. And that means it's often mobile from the ground and into places like homes. And while people say, well, alpha particle radiation, which is the problem gas, the problem that's given off as radon decays, it doesn't go very far. And that is true as a form of radiation. It doesn't move nearly as far as gamma or X-ray radiation. But its difference is that it passes a lot of energy off as it decays. So as radon gas breaks down, it gives off a high LET or high linear energy transfer. And that amount of energy, even though it goes a short distance, is what they believe initiates the breakage of DNA and leads to the development of cancer. So there's actually 3 different pathways that radon has been associated with the development of cancer, but the result has been that IARC has designated it a group 1 or known human carcinogen. The volume that it came out was in 1988, if you're looking for the reference. And since then, all other international agencies have acknowledged its role as a primary carcinogen of concern. So as radon gas is inhaled, so interestingly, radon is not considered a problem for the skin, in part because their energy doesn't go particularly far, even though it is a lot of energy. But when it's breathed into the lungs, radon gas, the alpha particle, and then the alpha decay products, so also known as radon daughters or radon progeny, continue to give off radiation over time. And so when that happens within the lungs, it can lead to double strand breaks, the creation of oxidative species, and then hypomethylation. And these three things together can trigger and contribute to oncogenesis. So radon causes lung cancer, and I'd just like to spend a moment talking about the importance of lung cancer in Canada. Cancer is now the leading cause of death, and of that, lung cancer is the leading cause of cancer death, even though smoking rates are coming down. And so more and more we're turning to what are some of the other factors that contribute to the development of lung cancer. And it's particularly problematic because the survival rate is still quite low. It's only about 22% of people are still alive after 5 years. And partly that's because we don't have a good system for early diagnosis, particularly for people who are non-smokers. In Ontario in 2016, they released a publication that tries to contextualize the burden of exposure to radon in terms of cancer. And you can see here very clearly, these are all the different things that contribute to cancer from the environment. So this is beyond tobacco, beyond smoking. So of course, solar radiation has the most significant impact, but radon was second. And of that, it is the leading lung cancer risk. And I think what's interesting about this is it also eclipses many of the other things that people associate with lung cancer, including diesel engine exhaust, asbestos, and even the consumption of arsenic and air pollution. So almost by an order of magnitude. So it's serious, the contribution that radon plays, and it still remains an underappreciated and unknown carcinogen. I often get asked, what are the other health effects of radon beyond lung cancer? And honestly, the answer is we don't know. And that's partly because many of the people whose contribution to our understanding of exposure and effects were men who were workers. So we haven't looked at exposure to radon for other purposes, other modalities, and other outcomes. So there have been ongoing studies here in Canada. Dr. Jing Chen just released an analysis, an ecological study, but an analysis of leukemia and lymphoma. There are showing a positive correlation with radon exposure. There are childhood leukemia studies as well that show a correlation. Gastric cancer is less clear. Radon is soluble in water, but it may contribute to gastric cancer, but these studies are still underpowered. There's a follow-up of the radon-exposed occupational cohorts I spoke of before, and Canada has a significant role in these analyses. Some of you may be on the line, may be involved in these cohorts, but they found other lung diseases and then relationships with cerebrovascular diseases. And then interestingly, there's new research that's being done, both ecological and cohort studies of exposure during pregnancy. So particularly in the United States, where there's more and more data being collected and more power to do health research studies in Texas, Connecticut, and Massachusetts, looking at outcomes such as low birth weight, other fetal outcomes, and in maternal outcomes, including things like hypertension. So these are interesting studies, and we are following them and hope to update the epidemiology as we know more. So radon continues to play a challenge both for public health and for researchers. Exposure assessment can be difficult for research studies. It is an indoor air contaminant, and every home is different. And as such, it's hard to make averages or assumptions about people's exposure without actually testing. And what we've learned over time is that things like age of home are not a very good proxy for radon exposure. And as such, residential histories can be difficult to construct. And that we also know that people are exposed in other places besides their home, including at work and school. And interestingly, the University of Calgary researchers have looked at the impact of the pandemic on extrapolating risk from radon exposure. And as people spend more time at home, we can confidently say that they're likely more exposed to radon gas. But still, people do go to work and school, and these aspects and these time periods need to be factored into exposure. So more testing really provides more insights for us. So every home is recommended to test in Canada, but as health professionals, we'll also learn more about exposure, which can allow us to know more about health outcomes. Dr. Ching Chen has been very busy recently. She's put out a whole bunch of studies, but I'd like to point to one that looks at the age of a home. And this is why we can't really use age of a home as a good proxy for radon exposure. And the bad news is that in Canada, radon levels appear to be increasing. So since over the last 100 years, so looking from 1910 to 2010, we see this gradual increase and then a bump in the 70s. And what some of the things that may be going on here include how we're building homes and how we're renovating homes. And we aren't alone. The United States is also seeing this gradual creep or increase in radon levels. This is not seen in Europe. So there are some countries in Europe where radon levels are going down. As I mentioned before, there is new information about exposure in Canada. Between 2009 and 2011, the federal government did the Cross Canada Radon Survey, in which they estimated that 7% of Canadian homes were above the 200 becquerel guideline. A recent analysis of far more data points, that original study was 14,000, we're now up to 75,000 data points, shows that actually that number is more than doubled. So the University of Calgary led this analysis, and we suggest now that about 1 in 5 people live in a home where the radon levels exceed 200 becquerels per meters cubed. So how can public health people get involved in this important exposure and help reduce people's exposures? The federal government has recently released what they call action guides for provinces and territories. They have 4 areas where they recommend people can do work, and I'm going to provide examples of each one of them. Education and awareness, supporting community testing, creating databases and maps, and Dr. McVea will speak to that, and then updating worker and tenant protections. But one of the first things I think I'd like to point out, so Statistics Canada does ask questions about radon every time it does the census. Some people are selected for the Household and Environment Survey, and on there's a question about, are people aware of radon, and then what is it? And so we see that even today, or the last time the census was presented, only 40% of Canadians can still accurately describe what radon is. So we have a real fundamental awareness problem. And then, of course, on the right-hand side of this chart, you'll see that that translates into a lack of action. So still less than 10% of Canadians have actually tested their home for radon. And you're not going to make a difference or a change in your home unless you actually know what your levels are. And just to be very clear that while we have had some building code adjustments to address radon, they are not systems that remove radon from people's homes. So there's not much that's been done in terms of structural change or other kind of change to help reduce risks. So testing is still very much necessary. So how can public health get involved in education and awareness? So I've provided a few examples here. Simply putting things on web pages can be really important. So this is my colleague Greg Batalans and Dr. Sylvania Mima from Interior Health. They've run all sorts of different programs and put information on their website. In Ontario, some of the health units and public health areas have also provide information. So that's a simple thing you can do. It's just to have a section on your website. And there are still places in Canada and public health where we don't have radon listed as an exposure of concern. So you could just add a section to a website. And this month is Radon Action Month. So you can showcase Radon Action Month. If you have a public relations or communications department, you can have them start to put out information on a social media, promoting Radon Action Month. It's Lung Cancer and Lung Health Awareness Month is November, so it all nicely fits in together. Some organizations have competitions and contests where people give away prizes, so you could easily promote those as well. This year, and thanks to assistance from Health Canada, we had a Light Up the Signs program that occurred all across Canada. This is Science World that was last week here in Vancouver, but the color purple is what we're using to promote Radon Action Month, and so we had a number of signs light up across the country, and this also makes for easy, nice social media as well. And Sandy, I think I saw you on the invitation, but hello and thanks for helping out in Winnipeg. You can also engage with your provincial cancer agencies. And this has been really effective in British Columbia. So we have been spending time talking to our cancer agency colleagues, promoting. We provided test kits to employees in the cancer agency. They took them home and tested their home and spent time talking to their staff. In Ontario, they've done similar programs and they provide information about radon on their websites as well. So this is really a really nice collaboration in BC. We've had case control studies emerge from scientists who've learned about radon. And remember, it's not just just the public who don't know about radon. It continues to amaze me how many health professionals and people within my own field, environmental health, radon is just not something that's particularly highlighted in the curriculum. So lots of people don't know about radon that should know about radon. So this educating people within the cancer journey or the cancer spectrum is actually really effective. Another place we found a lot of easy traction is supporting local libraries. So over 500 libraries across Canada now provide digital radon, or now they're now called electronic radon monitors. They're very popular. We frame them as a screening test. These are not necessarily what you need to conduct a 91-day test, in part because the library won't let you keep them for 91 days. Usually the loan period is shorter than that. There's lots of different ways that these can be funded. So you can go to a library and help them apply for different kinds of grants. Health Canada also helps libraries engage with radon testing, so that's another avenue. And also just librarians, like a shout out to all of them. They're just the most fantastic people. And they are willing to do all sorts of things for Radon Action Month as well, put up banners and signs. So I can't say enough great things about reaching out and working with librarians. Take Action has an easy program too, so you could also just let the libraries know in your province that this program is available. And then we had a really nice collaboration with the BC Cancer Agency. So their library also lends detectors like this as well, particularly for patients with cancer or their families, because often people who don't smoke want to know why they got lung cancer. And this might be one of the issues. And by reducing levels in homes, you can reduce other people's risks as well. So the BC Cancer Library has 37 devices that they lend out, and you can see that 10 of them are checked out at this moment in time. So that's great. Another thing that public health can do is connect with nonprofits to promote test kits. So for a while, people would say you could buy a radon test kit at a hardware store, and that's almost patently not true across the country. So they are not stocked, or at least the ones that are certified are not necessarily stocked in hardware stores. And as a result, people have to go hunting for them. And public health can help orient people towards where they can get cheaper ones and where they can get ones that are certified. So for example, in New Brunswick, they have an easy link to the New Brunswick Lung Association. And here they actually sell fairly low cost, but professional or certified test kits. So this is another easy thing you can do, is just make sure that people who want to get a test kit can easily access one. As a public health professional, you can also learn about radon testing issues. So as more and more people become interested in electronic radon detectors, there are issues. And one of them is that not all detectors are the same, and some of them have been recalled. So it could behoove you to keep up and learn about the different devices that have been recalled and point people to the ones that we know are certified and have been assessed for their use. The Canadian National Radon Proficiency Program provides an updated list of devices that they've been following and doing quality control on. You can see at the top, those are the ones on the left-hand side that we use in the libraries. But people really like these kinds of devices. They provide them with interesting data. People want to get involved and learn about them over time, but just to be aware that some of them are not what they seem. So make sure that we're warning people and keeping them up to date about recalled devices. So shifting gears, you can also engage with testing programs, even without having to run them yourself. So there are community level testing programs all across the country. We welcome involvement from people in public health to take part in them, the ones that I work with. Some of the ones that you might be familiar with is the Take Action program. I'm going to talk a bit about it. There's also Evict Radon that operates through Alberta and does sell test kits to communities across the country. I ran a citizen science program at SFU for a while. It was very popular. People really like being citizen scientists. And then there's organizations like the Donna Schmidt Lung Cancer Prevention Society that operates in British Columbia that gets people testing. And I also think about health equity. A lot of these programs provide low cost, or in the case of Take Action, free radon test kits, and also help connect people to mitigation grants. So this is something really to consider, is that often people who live in basements or other places where we know radon is more of a problem tend to be lower income people, particularly lower income seniors. So just keeping health equity in mind, you can address radon through some of these ways. So just a quick overview of what the 100 Test Kit Challenge is and how you can get involved. This is a program that provides 100 free test kits to communities for 100 days. So people use the passive alpha track detectors. And we use local community contacts and liaisons. So it can be municipalities are often who gets involved, but it can be other people. Public health units in Ontario often apply and get the 100 test kits themselves to run the program. And it's an inclusive, low barrier program. So we don't, for example, rely on shipping. People go to a town site, pick up the test kits, test, and then bring the test kit back. And that reduces a lot of, things get lost in the mail sort of thing. So it's a very robust program. It's been operating now for over 6 years. 146 communities have taken part all across the country, testing for radon, which is great. And there's a bunch, I think there's over 42 testing this fall as well. And so this is sort of how it works. So public health can get involved by telling communities about the program, encouraging them to test, and then they can show up. So we have a launch meeting for each community. So if it's someone in your region, we welcome people, environmental health officers or MHOs are welcome to come and talk. We give out the detectors at different places. This could include public health units. We've even had community medical clinics give out the test kits. And then people bring them back in the spring. Then they get information. Oh, there's just some pictures of what they look like. So historically, we used to go in person. This is the mayor bringing his test kit back. But now in the far right corner, we have switched a lot to Zoom. So we're able to just do more communities in farther flung places by using Zoom. But again, we welcome public health people to take involved. There's no cost, again, for anybody. This is funded by Health Canada. So when people are done testing, each person gets their own result back. We then have a session where people can come and ask questions about the number, but then the community gets a test kit profile and it shows how many tests were high above the 200 guideline level. This is one from Weyburn, Saskatchewan, and unfortunately, this is not unique in Saskatchewan. We often find many communities have homes high proportion of homes above 200. And these are what we call the aggregate community reports, and these are all publicly available. So no matter where you are in Canada, you can go to the Take Action website and look at the summaries of the communities that have been done in your province if you're interested. It's a freely accessible public data source. It tends to generate a lot of news. Right now, Mount Pearl Newfoundland is really going gangbusters this fall. So I think we have 6 communities in Newfoundland testing. I think it will be the highest per capita radon tests of all provinces at the end of this year. And then Chatham-Kent, the public health folks were really involved in Ontario, and they were able. This was during the pandemic. And those are the test kits that we use, the ones in the plastic wrap, the passive detectors. You can also promote radon mitigation information. All homes can be fixed very significantly. So this chart on the right, just in the red, shows the radon levels before radon mitigation, and then the blue is after. So you can see this was organized by province. I'm sorry that fell off the axes on the bottom, but you can see that houses even way above 1,000. So that's 5 times greater than the regulatory limit. Were easily brought down to far below 100, which is a WHO's recommended. So promoting mitigation and mitigation resources is something easy that can be done on websites as well. And there's many national guides. Health Canada has lots of information. The Canadian National Radon Proficiency Program that does the testing of the devices and the certification of professionals. And then also there's building standards. And these are publications you can simply link to on a website to let people know that they exist. And at this point in the presentation, I'm going to hand it over to Dr. McVea, and he's going to talk about what provinces can do. It's a bit more involved than promotion and awareness. So do you want me to keep sharing my slides, David, then? And you'll just say next?
Sure, that's fine. Thanks very much. Thanks, Anne-Marie.
Sure.
Um, so yeah, a lot of what Anne-Marie has talked about there, a lot of those efforts and those initiatives depend on being able to communicate with the public about the risk that they may be exposed to from radon, and also about prioritizing our efforts. We all work in big, large provinces that have really highly varying degrees of population density. And so understanding where to prioritize based on where people are living, where the risk is highest, these are very important aspects of working with radon, as with any public health initiative. So Anne-Marie talked about one of the key features that can kind of determine exposure to radon being geology. Because radon is produced as uranium in soil and bedrock decays, the underlying geology has an important role in what radon people can be exposed to. And this map here is a map of radon potential produced by Radon Environmental across British Columbia. So using geological features, they show what level of radon exposure on a kind of a three-tier scale people may be exposed to. You can see kind of a general pattern there where the southeast corner of the province has a lot more of that darker red. But looking across the province, you see there's ribbons, there's pockets, there's little dots of high potential areas scattered all across the province. So looking at geology is really just not enough. The other feature that Anne-Marie talked about was homes themselves and the age of homes, how energy efficient they are, how the ventilation system works within a home. These can also really influence the level of radon that is present. So depending on how old a neighborhood is, how much renovation has gone on there, and so on, you can see unexpectedly high levels of radon. So understanding what level of radon people may be exposed to is not a straightforward feature. Every home needs to test. So next slide, please. So to try and get a sense of what's happening in British Columbia, uh, BC CDC back, over a decade ago began doing sampling in BC homes, and you can see some of these really early preliminary data shown in that map there on the right-hand side. This is a report that was put together by kind of the medical director 2 or 3 iterations ago, Dr. Ray Copes, and you can see that those circles are kind of highlighting areas of higher levels of radon that were gathered from homes. But if you look then at the table on the left-hand side, you can see that there's a column there that has a number of homes tested, and some of those regions, some of those communities have a half dozen, a handful, a dozen of homes that have been tested. So really not great data coverage, not good spatial resolution, certainly not the power, the number of recordings that would be needed to tease out some of those more subtle health implications that Anne-Marie was talking about earlier. So next slide, please. We knew, and when I say we, I really want to give a lot of credit to Anne-Marie and to Jeff, who's on the call also, who were doing a great deal of work on this before I joined BCCDC. But as a whole, BCCDC knew that there was radon data around the country, around the province, in other health authorities, in industrial partners, in testing groups, and so on. And those sort of puzzle pieces were scattered across the province. So we decided to put some work into bringing them all together to create a cohesive whole, a cohesive picture of what was happening with regard to radon in the province. And we call that the BC Radon Data Repository. So next slide there, please. So this slide gives you a glance of the BC Radon data repository as it is now. So we have data from 19 different external data providers. We're very thankful for their generosity in sharing their data with us. And you can see the collage of their logos on the slide there. We now have 44, almost 45,000 unique measurements from across the province. Not all of those are different buildings or unique buildings, of course. Some of them are different floors of the same building or repeat tests from the same building. So we have about 24,000 unique buildings. We have 25,000 residential measurements, and then about 23,000 points that can be geocoded to an actual point in the province, a location in the province. Something I'll comment a bit more in a moment is a key feature of the BC Radon repository is that we share our data. We make it available to other people working on public health research or public health action programs, any kind of the work that Anne-Marie talked about. And so we've to date received 6 external requests to access our data. I'll give some examples of that in a moment. Next slide. Okay, great. Thanks. So this shows some of the success that we've had with the BC Radon Data Repository. So this shows the number of measurements that we have, beginning on the furthest left there, in the 1990s, early 2000s, BCCC had around 2,000 residential test results, some of which were done, arranged by BCCC, some of which had been shared with us kind of on an ad hoc basis. And then the BC Radon Data Repository kind of came into being end of or through 2021, end of 2021. And you can see that we began with about 15,000 data holdings, and then have increased steadily with a few big jumps over time, up to now where we have about 44,000 data points. And again, much of the credit for this goes to Jeff, who has continued to build relationships with external data holders and keep data coming in from new sources and new parts of the province. So the next slide, please, shows some of the value of having lots of data, high resolution data like this. So Anne-Marie mentioned the Cross Canada data survey that Health Canada organized in 2009, 2010, 2011, where radon levels were randomly assessed across the province. And some of our random data, which includes that Cross Canada survey, is shown on the left-hand side there. And of course, random data collected that way is great, but it's also hard to collect. You need to go out and reach and contact people. So that's shown on the left there, and you can see the number of gray areas in the map, those that have insufficient data to really show what is going on at a more resolved, finer spatial scale. But if you look at the map on the right, that shows our data that's being collected across all of the providers. And you can see that not only are there fewer insufficient data spots, many of the ones that we now have data of are those that have high levels of radon in the southeast of the province. Some of those are more sparsely populated and would have been harder to collect in a randomly sampled way. But now we do have data about them, and we have enough data to show and to give an assessment for the population, for the public, for policymakers, and so on for those areas. Next slide, please. So I wanted to talk for a bit about how we have had the success that we've had in terms of receiving data from many people. A big part of it is first of all that it's voluntary participation. It has depended upon going out, meeting people, meeting private industry, meeting testing professionals, talking to them, talking at professional conferences, raising awareness of the data repository and why we are building it. And then from that, we've created formalized data sharing agreements that we sign with each external party sharing their data with us. And those include some specific provisions that show that the providers will continue to own their data. We are the stewards of it, but the external parties own what they have contributed to the repository. And if they at some point want to withdraw it, they can do so. They make clear that we do only use the data for research and for health protection work, and we don't use it for any private or for-profit kind of work. We have an established, clear external data request process that makes the data available to other public health researchers or policy workers, as I described. And it goes through the same data request process that anything at BC CDC would go through. We have no person level data. We only have residence level data. And then also importantly, we anonymize all of our spatial data. So anything that we make available to external holders, anything that we put on the map, anything that gets sort of logged into the BC data repository is not a specific address, but it is an anonymized data point or geological point, geographic point that has been jittered, moved so that it can't be traced back to an individual residence or building. Yeah, next slide, please. Thanks. So for those of you who may be interested, we have published some of the more technical, specific details of the repository in the Canadian Journal of Public Health. I noticed that Jeff has just put the link in the chat, which is great. I acknowledge you can't see the details of this figure, and the details aren't important. I just wanted to emphasize that, when you're collecting data from 19 different parties, it's going to come in all sorts of different formats. It's going to be messy. So we have some clear algorithms to clean, standardize the data, depending on the detail that comes in with it, whether it's a full address, just a portion of the address, maybe it's just a municipality name in some cases. Um, we classify it to an appropriate spatial level, and we have a kind of algorithmically work through all that, and then we anonymize it as needed. And we have taken the time to consider whether these data that we are collecting look like what has been sampled randomly. And generally it does, but we want to acknowledge that these are convenient samples. We're getting what's available. And so it wouldn't match exactly what you would see in a random sample of radon data. So you can see here this map of British Columbia shows the ratio of the data that is in our holding compared to the data that, or I should say the data in our holding that was not randomly selected versus the data in our holdings that were randomly selected. And the darker colors show a higher ratio of radon levels in our data compared to the randomly sampled ones. And in some parts of the province, it is higher data or higher levels that we have in the repository than the randomly sampled ones. But there are some reasons why that would be. And Anne-Marie certainly highlighted some of those. So what Anne-Marie showed was that radon levels have been changing over time. So the randomly sampled data, it kind of comes back from over a decade ago, whereas much of the data that we have now in the repository is more recent. And so it is likely that it does have higher radon levels in it. Um, these are tests that people themselves have gone out and sought, or health authorities have targeted more at-risk areas. So there may be more data coming in from at-risk areas. And there's also something we kind of call the neighbor effect, which is that if somebody tests their home and has a high level, they'll tell friends and families and neighbors about it. They'll talk about it more than if they had a low level, obviously. But again, that's not necessarily reflecting anything inaccurate in our data. It's reflecting that it's collected in a different way in a different time period. So an important part of our radon data repository is an interactive public map that we made. So we first released it in 2021, and it was a desktop version at that time, and we've continued to update it and optimize it. I see Jeff again has put a link into the chat for that, so please go ahead and take a look. We have recently optimized it just this year for mobile devices. So you can take or take your camera, take a shot of that QR code and look at it on your mobile device if you'd like. There is actually a survey running right now on it to get feedback about it, how useful people find it. So you can go ahead and fill out that survey. It would be very helpful to us. And there's a bit of an incentive to do that with a $100 gift card that you can be entered for. So I'll show you a bit more about it on the next slide. On the left-hand side there, that shows what you see when you open it up in the desktop version. People can choose the metric that they want to see that shows either the percentage of people that have an elevated risk or elevated level of radon or the median level. They can choose the geographic level from health authority all the way down to municipality. There's a search feature where people can search for their homes, and then you can zoom in and pan, same as you would with any Google map or Apple Maps that people are familiar with. When you click on a region, it pops up that infographic that you see on the right-hand side there, and that shows a distribution of what 100 homes in that region might look like in terms of the radon level, and it has some details and some specifics about the risk that might pose to people. And generally, we've seen quite good engagement with this map. So this year is showing the daily page views since we started it, since we launched it in 2021. And you can see a number of spikes in the audience over time as we have some media that picks up on it, or a conference or another report that brings radon up to the forefront. You can see a couple of spikes for Radon Action Month in 2020 and 2023. This year, because of the election in BC, we have been limited in what we can say about any public health issue or any work that we're doing. So the map and the fact that we optimized it from mobile devices and so on, we're just beginning to post that in this past week. But we've had a number of events this week, so I'm confident that we'll get some really great engagement on it. But I'd love to see another spike there. So if anybody wants to take a look today. We certainly would encourage you to do so. But in between those big spikes, we see about 50 to 75 or so views every day. So even just as a general background, people definitely are accessing this. So I mentioned that we make the data available to external parties. Here are some examples of that. So you can see there Evict Radon has used it for their cross-Canada survey of radon exposure in residential buildings. Down below that, you can see a really interesting project from Université de Montréal that looked at the impact that oil and gas wells in northeast British Columbia have on indoor radon concentrations using our data. In the upper right-hand corner, BC Lung has been a great partner, and they've accessed the data a number of times to create a report that really sets out to communities that are most in need of testing because of where they are in the province and the likelihood that they have high levels of radon, combined with the fact that we don't have much data from them. Um, and then beneath that, some other studies that are ongoing. So one that is evaluating how different radon map designs can impact users' understanding of risk, and another that is investigating radon concentration across different building types, which is data that we do have. Uh, and then I wanted to talk more specifically about one example related to the BC Building Code. So previous versions of the BC Building Code divided BC into two regions. You can see on the right-hand side, Area 1, where a radon rough-in was required, meaning that built into the home was some features that would make it easier for a homeowner to activate a radon mitigation system if they decided to. And then on the coastal side, in Area 2, that was not required. BC Lung Foundation was pushing for some time for universal radon rough-in, saying that across the province people can be exposed to radon. It doesn't make sense to divide the province in this way. And in the lead up to the next iteration of the BC Building Code, they put out a report, and that specifically referenced the BC Radon Data Repository and the map that we designed. So you can see what I bolded there, saying that the British Columbia Radon Data Repository, the BC Building Code of 2018 list of community is out of date in the sense that it is possible to see many communities on this map that have an evident radon problem, which are not mentioned in the code, and the issue needs to be revisited and include data from the BC CDC Radon Repository and map. And in fact, that is what they recommended. In the next slide, they specifically recommended revising locations using the BC CDC radon map. And then, in fact, the BC government, as they developed the BC Building Code, on the next slide, you can see an information bulletin that they put out about changes to the building code saying new data, I think referencing our data, shows that radon exists in many areas of British Columbia where it was not previously known to result in elevated indoor radon levels. There is no longer reliable evidence to justify exempting certain areas from the rough-in requirement. So I think it's a nice example of that full pathway of collecting the data, sharing it with a partner very invested in this work, and then that partner using that data to advocate for a change, and that change being put into place to make it much easier for people in new homes to mitigate against radon if they made a decision to do that. And then I just want to note that thanks to Health Canada, who has funded much of this work and are continuing to fund it, and we're very grateful for that support, we are working to expand this across Canada. So right now we're working on a scan of what data is available across different provinces, how radon data is structured and where it's available, and how it could be brought together into a federal, national radon data repository. And Anne-Marie is leading much of that work, and so if you have any questions or availability, you may already have spoken with her, but if not, please feel free to reach out. And I think we're going to...
Yep, I think we're
I'll
wrapping it
let
up.
Anne-Marie take it home with the summary, and then have some time for discussion.
Yeah. Well, thanks so much, David. It is it's such an amazing tour of what we've done and what can be done with the data. So I'm always so excited and proud to see the database in action. So in summary, radon exposure in Canada continues to pose a problem. We are not building it out. We are likely building it in. We are likely making changes to our homes that are sealing them up and making the radon problem worse. So while new building codes are being implemented, people still need to test. Even the new systems, while they may reduce radon levels to some degree, they need the addition of a fan to make sure that they're actually health protective. So we need to continue to encourage Canadians to test. And as we're doing this, we're learning more about radon. And again, I wouldn't rule out other health outcomes of concern as time goes on and we learn more. There are many things that public health professionals can do, depending on how much effort you'd like to put into it, what your budget is, what the sentiment is around radon, where you work. So simple things are promoting resources, pointing to test kit providers for people, relaying important information about radon mitigation and health impacts. When we validate this exposure to communities, people often have never heard about radon. I was just on a call and someone said, well, if it's so important, why didn't somebody tell me? So I think we still have a big leadership role in public health where we can help people learn about radon and understand that it is a real problem. It's not just something that someone's trying to sell you. For moderate engagement, you can go talk to local librarians or give a webinar or get involved in the 100 Test Kit Challenge. That's also free, and we're always happy to include people along the way. And then greater engagement would be building provincial resources, such as David mentioned, and working with your building code officials within your province to help promote changes and policies and practices. So thank you for listening. I'd like to thank Riley Condon, our research assistant, and Jeff True. He'll be here on the call to answer questions about, if you have, about the map and the Take Action on Radon program, for providing me with information about the results of the testing.